up, baby?
You alright?
Good,
It's
man.
good to see you, man. You alright?
Everything good.
Man, you over here looking like Drizzy Drake.
Easy, man. Look,
How are you, Destiny? You alright?
Hey, finally met, man. It's a man right here.
You
man.
are.
How's everything, man? How you been?
Destiny, dude, thanks for coming out.
Of course. Thank you.
Catch me up. You're in Mexico right now, playing
Yeah,
for
Toluca.
Toluca. And how's that going?
It's good. I like it a lot. I was kind of struggling a little bit in the beginning, but it's definitely getting a lot better.
You feel good, like
Yeah.
being out there?
Yeah, I've learned a lot.
I see your content, man. You are putting in some work.
On the go, yeah.
So what's up? Catch me up. What's going on? What do you feel?
Right now, well, Eric's been killing me, so I'm
Yeah,
super sore.
as he should be.
Yeah, I'm super sore, but I don't. You probably don't know, but I torn both my ACLs.
Okay.
So
I think I had seen a post of you recovering from an ACL repair surgery.
yeah.
Left and right.
Yeah, both.
Oof.
So this one was like 15. This one's 19.
2015 and 2019.
No, age 15.
Oh, when you were okay. How long ago was that?
The last one was, I want to say about 4 years ago.
So 4 years ago, right here.
4 years ago was the last one.
Okay.
Yeah, and this one was about like 8.
So what do you feel? You feel stiffness, discomfort,
Yeah.
pain at all?
Sometimes I get pain. Like it's really hard for me to do like some like lifting and stuff like that because then I just feel like I can't do it. You know, I feel like restricted.
Restricted.
Yeah.
Okay. So it doesn't bend down as much.
It feels kind of stiff.
Okay.
Yeah.
Let's get you on over here, Pop.
Man.
So we can see what's going on. Do you feel like you have pain in the front at all, or up top, or on the sides? Where exactly do you feel like you have discomfort?
I would say more like on like the insides, but I did both patella, so I think that's why.
Oh, that's absolutely why.
But I've actually had 2 injuries already during season that our doctor told us I guess there's like a little baggie inside that inflames really.
Yeah, it's a bursa. Mm-hmm.
Yeah, so.
You have bursitis?
I have no idea.
What movements currently right now when you're playing do you feel more so restricted? What are the movements that you feel like, oh man, I wish that if I didn't have this discomfort here, then I'd be able to do it more fluidly without any pain? What do you feel is most debilitating for you currently?
Change the direction, you get really sore after a good push day. She gets sore, especially right now. Are you still tight?
Yeah,
I know she's having. Did she tell you that? She's having them pretty. It's pretty tight in the back of
In the
her.
hamstring?
Yeah. So
And all my hips.
we did linear speed on Monday. So it was a lot of sled pulls. When sled pulls, a lot of sprint outs, banded pulls. That's really what it was on Monday. But change the direction, she gets really
So doing this?
yeah, any
hurts her?
movement breaking down from one point, change the direction to the other, and
It's still tender?
I think it's because we just did so much work.
Bear with me. Relax everything. Does it click and pop?
Yeah. All the time.
Good. Good. Stability's pretty good. I mean, I don't see any red flags on that right one. Relax everything here. You have pain here when I do all that? When I push here?
A little bit.
A little bit?
I don't know if it's pain or if I'm just yeah, that kind of.
That hurts too. And you said the back hurts too, huh?
Yeah. It's more the by my calf, the top. Yeah, right here. Oh yeah.
All right, we're gonna do some mobility work and scraping along the quad. Your hip flexors are tight too. So if you're having stiffness here in the front, is that right? Yeah. So that pulls on the quad. Quad pulls on the top part of the patella. Starts pulling this a little bit more and starts causing you to have that. You already have naturally discomforting symptoms here because of what the procedure that you went through the ACL repair. But you also don't have good mobility within your quads either. Obviously, you work them out a lot. The back compensates and tends to strain a little bit. So we're gonna do some mobility work. We're gonna scrape. I'm going to stretch out your hip flexors. I'm going to give you an adjustment as well. We're gonna put some therapy on here as well.
Okay.
Cool?
Perfect.
All right. Destiny, don't hate me. What we
Very
want.
convenient.
This is a thing that we need to start giving yourself more mobility within the quads. The more mobility that you have within your quads, the more flexibility that you'll have. More flexibility will equals less pain on the knees, less pressure. So it's very important, it's imperative, because all you do is you work off of these quads, you work off of these knees.
And I was telling Eric, I think yesterday or a couple days ago when we were lifting, that I'm more quad dominant.
Yeah,
So
that's
why
what you
it's-
do. Yeah.
Yeah. Because I know there's some people who are more like hamstrings and stuff, but mine is
Exactly.
straight quads.
So, and this is what you work out every day. So
Yeah.
you want to make sure to always give yourself some mobility work. And that way it takes so much pressure off the patella tendon too, just because of that repair that you had, the ACL. So talk to me about Toluca. How's it going?
It's good.
It's good?
Yeah.
They have you guys, like, how's the experience?
It's good. It's definitely different compared to the first team that I was at.
Yeah.
Here I kind of feel like a little bit more, like actually like as a professional, to where I was at when my first team wasn't too. It was just the professionalism was more of like the title
Yeah.
of the team rather than how it was inside.
What do you like about being part of the Toluca team, the women's Toluca team?
They're like I said, they're very professional. The staff and everything,
Yeah, they take care of you guys?
Yeah,
That's
definitely.
good. Now, obviously, oftentimes, like when you have an ACL repair, the way that the tissue re-heals is through the form of scar tissue,
Yeah.
right? So you tear through a tissue right here to make the incision and to make the repair. And the way that I like to describe scar tissue is that all the broken pieces start gluing back together. As scar tissue, it's not regular like muscular tissue.
Yeah.
It's not flexible.
That's what you said.
It's meant to stiffen you up and to guard you from anything else like
Yeah.
happening. That's what scar tissue is. So it's very important to get some mobility work done on scar tissue, like build up, so that, because right now it's probably very difficult for you to bend it all the way and get that full flexion and feel okay with it. Just like, like it really kind of pulls there. Outside of what you have inside, the way that the repair was, you also have residual scar tissue which you have to like break up so you can get more range of motion. You know, somebody who's in your position, Destiny, as far as like you're living off your body, like you have to treat it much more of a temple than me. I mean, sure, you know, but you have to perform. So
Well, I don't know if you saw that post. Russell posted. He spends like $1 million on his body.
yeah,
$1 million just to take care of his body.
LeBron James like 1.3.
dude.
Yeah, that's crazy.
LeBron James, like, you know, Kobe, like all these guys, like they spend millions, man, millions.
They perform at their best too.
Because I mean, if they spend millions here, they're gonna make hundreds of millions, like
Exactly.
outside
Doing
of
what
that,
they're doing.
right?
Yeah,
Yeah, like
sure.
there's no way. And you know, although like I'm not a professional athlete, man, but
you feel it. You
but
feel
if-
it after a while.
Yeah,
Right?
yeah.
Imagine them that they,
Like-
that's what they do. It's a constant beat up to the body.
Yeah.
That's my job. It's like,
Dude,
man, why wouldn't you? take
if
care
I
of it?
walk in here with a pinched nerve, I won't be able to see you.
Yeah.
You know, I'm like, all right, man. So, you know, maybe I should get adjusted
You have
too.
to.
Yeah. Sometimes, man, I dread it because I have this nagging shoulder pain, and I know how Perla's like mean old
What?
elbow.
You ain't met Perla, dog.
She
You don't want
sticks it
Perla,
in the
man.
ear, and then like she starts like, and then I'll have Jake also start scraping me. And I'm like, man, I really don't want it done, and I feel what
But
you
you have
feel.
to,
But it's like, okay, if I don't fix this shoulder, then I won't be able to like
Mhm.
knock down a mean elbow or
Exactly.
whatever, you know, or adjust people.
How often do you recommend somebody to do this?
And that's
coming from an injury like this. Like, I mean, you got to think of your body like a car, like right. You got
Absolutely.
it up to service it.
Yeah.
So something like this, you know, how often?
How
would you-
often? And that's a really good question because I like to gauge it off of the amount of physical activity that you do. Destiny, how often do you play soccer?
Every day.
every single God-given day, right? And not to the degree of like, oh, I'm just gonna go kick the ball. No, I'm gonna go train. Somebody like her should be doing this at least once every like week or two.
Got you. From the full service of
mobility, right? We want to make sure that nothing is going to stop you or restrict you. The more that you're restricted from a mobility standpoint, the more that you run the risk of injury.
Yeah.
That's just obvious. So you definitely want to start getting some work done regularly. And even though it sucks, it's short-lived. But yeah, but for somebody like the average Joe who doesn't play for Toluca, who's not a like professional soccer player, it really comes down to the level of activity. If you're working out 5-6 times a week, then I recommend at least like once every 2-3 weeks. If you're working out less than that, then you know, if you're stable without any pain, I can see you once a month. And cool, you'll be okay, you know. But
you see it?
Hey, that is true though. Everybody does have an uncle or somebody that you know that's a sobador. Oh, te soba bien. No, I'm good. I'm not going to the sobador.
Dude, I would have kept playing soccer, but then like I fractured it, and I didn't know it was fractured. Obviously, I was a kid, and then
you're like, all I want to do is go.
Exactly. And I'm like, oh, we're gonna take you to a sobador, and I'm like, all right, well,
I can play again. Let's go.
And this dude was like a boxing specialist sobador.
Oh my god.
He had like a ring in the back, and I was like, dude, I don't even want to go in there.
And
then like, and I remember just laying down and just like, I was tripping out, right? I was like, man, I don't want to like, I hurt. It was like swollen. And he's like, oh yeah. And he would start singing, and all of a sudden, like, whack! My ankle. Like, oh my god! Like I hated it.
But did he fix it or did he just mess it up more?
At that point, I didn't even know. Come to think about it, dude, but it was fractured. Like
already,
it was already like a hairline fracture, I believe. And I went to orthopedic, but man, and the moral of the story is like,
don't go to the sobador.
We've all done it.
Facts.
We've all done it.
But
had I gone to somebody like Spinal Performance, dude, I would have probably still been playing soccer today.
That's facts, man.
Yeah. Dude, that was funny.
Dude, don't go to the sobador.
It worked out, man. I became Dr. J. I'm gonna do a different type of therapy on you. I know that you're used to the whole ultrasound game, but there's actually like a combination type of therapy with an interferential current. It feels weird, but it really gets in there. And honestly, I've seen really positive results with it as far as like pain and swelling and all that. So here we go. You are gonna feel a little bit weird though. I'm gonna move it as much as I can, but the more that you could take on the electricity, the better. How does that feel? Is that too much?
That's fine.
Okay. Less. All right. Cool. Don't let it freak you out.
Okay. Yeah. No, that's fine.
Good.
It's almost kind of like complex. So we're like.
Oh yeah. But I'm trying to get the ultrasound waves to penetrate right through your patella tendon where you had all that stuff going on. Man, like you see basketball, you see all these soccer players, they get out of the game, they go straight to the bench and start icing their knees. Never forget that.
I haven't been icing my knees, but
yeah, you need to ice your knees regularly, especially because of the wear and tear that soccer has on you. You're playing soccer, God knows how many hours a day.
Like 4.
Yeah, so it does become a lot after a while. So make sure you're icing them up and stuff. Just bear with me. I'm going to stretch out your hip flexor. You need to start stretching out your hip flexors because you use them like obviously a lot, like during soccer. Do me a favor, push this down. 5, 4, 3, 2, 1, let go. Good. And push down again. 5, 4, 3, 2, 1, let go. Good. And you got one more in there? Push. And relax. Good. Proper hip mobility will help, obviously, with all the soccer that you do, as well as maintaining your hips in line, which is important. It's imperative for you to be able to not have hip imbalances. That way you're not distributing your weight unevenly on both sides. I'm gonna push some of these bones. We're gonna hear some cavitation, some popping and stuff. I'm gonna give you a spinal alignment, okay?
I think I need that for sure.
Yeah, it's been a while, huh?
Yeah, and because I do, I have like, I take a lot of our throw-ins because I have a long throw-in, so my back is always messed up.
Oh, okay, yeah. So all of this takes toll on you when you do long throw-ins.
Yeah, my back is always really so sore. I have chicken.
Okay, I want you to give me a deep breath in and all the way out. Good. Relax the right and the left. You're gonna hear some cracks and pops. Good. Good. One more. Good. Good job, dude. Let's have you on your side. Face me this way to your left. Okay, just this leg. I'm gonna bring it up. This one's gonna stay down. Get closer to the edge for me. Perfect. Let me borrow this one and bring it down. Hold that right there. I'm gonna push here and back here. I want you to bear with me. Just relax. Good. Let's get the other side. Feels good, right? Yeah. Especially after you haven't had it in a while.
Yeah.
Relax everything. Good. Face up now. Now, if you score like 20 goals, you gotta give me a little shout out up there. All right, hold tight, okay? I'm gonna give you a neck adjustment now. Good. This is especially important for you because of all like the headers that you do too, like inside of the games and stuff. Good job. Woo! You survived. Let me help you out. Good job. You did really good today.
Thank you.
Do you have any questions for me?
No.
Good. Keep up the good work. And we want to see you more often too.
Definitely.
Let this not...